Dr. Fauci paid somebody to come up with biological warfare. There was a letter. Who was this letter by? Who was it delivered to?
The NIAID letterhead is there with his signature.
I could come up with a letterhead today, Dr.
I can Photoshop it.
I can do a letterhead today and say that it was written by Dr. Eda Tatu. I could do that.
Yeah,
anybody could. There has to be beyond reasonable doubt that something like this has happened, and it would have some traction on the global scale for us to say, wait a minute, there's something here.
Yeah,
there doesn't seem to be anything like that. From what you're saying? No,
because the Dr. David Martin is actually mandated to do that.
By whom? For what?
For the American. He works for the America. He works in the United States.
As who?
And he's actually been mandated to be like the watchdog for bioweapons. Yeah.
In what organization?
That is his career.
In what organization? By the American government?
Yes, by the American government. That's actually his. So when he says that it is, and he came up with that letter and it was never denied, and he made this presentation to the World Health Organization, that is what came out, and it is true. And the problem is that the World Health Organization had already from 1947 had declared itself immune for all types of prosecution. So that is why we're in the situation that we're in. It's to raise awareness, because you can sue for any product in the world if you have an adverse effect. But when it comes to vaccines, the vaccine cabal has actually allowed themselves to have complete immunity to that. Well, and in a document that was signed by President Bush in 2005. So that is the dilemma that we're in. It's just advising people to find out whether a jab is necessary. Like you said, always start with the question, is this necessary? Especially in light of there being any other treatment. Yeah, for example.
Well, this doctor that you've actually quoted a few times has been, in terms of credibility and just evaluating a lot of the statements that he's made, he's also been mentioned as someone who's come across as making very extreme claims that either lack scientific proof or peer reviews, and also there are questions around verifying a lot of the things that he's also said. And in terms of framing of events and situations like this one now we're discussing, there are fact checkers that have said, look, the things that are very scientific, and I just want us to take a step back from all these different views and just look at coronavirus we knew. The thing is, before 2019, coronavirus actually was there, just like other viruses. The Ebola virus, the Marburg virus, there is the Lassa fever virus, and there's so many other these different types of viruses that come as a result of human-animal interactions, for example, either from rodents or from bats in the case of coronavirus. And you start to trace from the 60s when there was the first case that was reported, and this was in Europe, but this was not, there were respiratory issues when the first case was reported. Then the build-up, and this is all scientific, there's evidence that backs these claims. Then you come to 2019, you're saying that Fauci actually funded a lab in Wuhan that then ended up creating this virus in the lab, then to unleash it first in Wuhan, China, killing so many people there, then spread it around the world to depopulate. So the agenda was to depopulate the world. Is that what you're saying? And you've mentioned a cabal that then was behind this, and you've mentioned WHO was behind this. So how is WHO then benefiting from depopulating the earth? You mentioned the issue is making money.
Yes.
Then money to do what? To create more vaccines, or money to do what?
You know that the World Health Organization is 88% funded by the Bill and Melinda Gates Foundation. Yeah.
So Bill Gates is also part of the cabal.
Oh, yes. Yeah, definitely. He's done a lot. He's spent a lot of money to clear up his image as a philanthropist. But actually, even he himself has said that most of the money he has made is from the vaccine industry. He gets his money back through that. And what you're talking about, the coronavirus as a pathogen was first isolated in 1965 in the United States. And then in 1966, that is when and between 1966 and 1967, that's when the United States of America and the UK had a collaboration to try and make it infectious to the human being, so that they could create a vaccine for it. And so this is how far the issue goes. And the World Health Organization has, there's three parts. There's actually, did you know that there's a council for eugenics inside the World Health Organization? It has a eugenics department. The eugenics is actually a pseudoscience, and it's all about how to reduce the undesirable populations from the world. And this is what has been, even the first and second directors of the World Health Organization actually put this as part of their vision for the World Health Organization, is to reduce the population of the world.
Why? What's the benefit of
Eugenics,
reducing the world's population?
You know that the eugenics department, eugenics is all about there being a hierarchy of races, with the blonde and the blue-eyed, the Aryan at the very top, and the Africans at the bottom. And Africans we have resources, so it makes sense to reduce the African population.
But Africans didn't die during COVID. Africans did not die during COVID. That was what the thought would be. I believe it was Melinda Gates who actually said to people, well, this is actually going to affect Africans. It didn't. Italians died. Americans died. Brits died. The people that you're saying essentially eugenics would protect died in greater number.
But the whole idea was to bring the jab. Are you understanding the Hegelian dialectic?
No, the idea didn't come to fruition.
It didn't come to fruition,
COVID,
yes.
Right? So can we actually say that based on what you're saying, that if that was the thought, if this eugenics department operates with or exists within the World Health Organization, and if one of the ways to then be able to make the ideology come through was through COVID, that was a big belly flop.
Yeah, it did flop because, first of all, the idea didn't take very well in Africa, did it? And you need to remember that we have sunshine, we have access to vitamin D, which is something that's very big in the immunity. Our diet is much better. We have water, we drink plenty of water. But actually, if you look at the countries where the people really died, their diet is not good. So the
Italian diet is one of the best diets in the world. It's the Mediterranean diet, one of the best natural. They grew up eating this food. How did they die in number?
Well, they had a lower immunity. That's what I know.
The older Italians have come up with 50 years of eating olives and tomatoes and living off of the Mediterranean diet is being used for diets around the world today. If what you're saying is true, Dr. Tatu, why did we have Italians essentially being the ones dying like flies off the face of the earth if what you're saying is true? From COVID. Not anything else. Doctors were called out of retirement to take care of the sick who were coming in droves to Italian hospitals. Why?
Well, it's not necessarily that they were eating from the Mediterranean diet, but there was a lot of death in the Western countries because of the lower immunity. Because there is a lot of, especially like in America, you have the African Americans tend to eat a lot of junk.
Did the
compared
people
to-
who, let's take the folks who work in the World Health Organization, and of course we know that they have their tentacles around the world. When you talk about sun, Africans have sun. They drink a lot of water. Did they not know this?
This is what in fact, all that information was being suppressed, just like access to the repurposed drugs.
Oh, come on, they've been here. They know. There's a CDC on the African continent, for crying out loud.
Yes,
Did
but-
they not know that Africa has sun? Did they
Yes,
not
but
know
when we were
that it's
talking
possible
about-
that people could actually fight this disease with their immunity based on what is available on the African continent, the sun, the drinking of the water, the traditional diets? They must have known this. And so they've thought, maybe we should tweak this a little bit more. If we're going to kill these people and suppress the population with this disease, we should also know. It seems to me that it's such an elaborate plan that they would have had and not taken into consideration that the sun exists in Africa.
In fact, I think you have a very pure heart, Ndu. Thank you very much.
Thank you.
It's very hard for, one thing we've realized, very hard for the African mind to understand how people can be sitting in a room.
I can understand. Please
Calculating, you know-
understand my question.
Yes.
How did somebody come up with such a scientifically elaborate plan to do away with populations of in Africa and still not take into consideration the things that you have said, that our immunity is stronger because we have access to the sun,
Yes,
because we
indeed.
drink water, because we have traditional food? You don't come up with such an elaborate scientific plan to do away with populations and not consider things that are natural to this habitat. How do you do that? These are
You know
guys
that-
who could pinpoint from where you sit right here.
Yes.
But they don't know that there's sun on the continent.
They do. If you would let me just speak, the whole plan was to bring out the vaccination on mass. You do understand that. And so the way they were going to do it, the maximum number of deaths was not really supposed to come through the bioweapon of COVID. It was supposed to come through the jabs. And the only way people would accept to be jabbed en masse was if they were terrified to death. You understand? So that the whole plan was the Hegelian dialectic. I said the problem, the reaction, and the solution. And all these recommendations that we, the doctors who were trying to save lives, talking about vitamin D, talking about diet, all these things were being very much suppressed in the population. So unless you were in that WhatsApp group, and if you had talked about these things, in fact, the word vaccine would have your video deleted from YouTube. Most of the information you'll find is on Rumble and the alternative, the media. But if you have the word vaccine, if you had the word COVID, your video was flagged and everything was pushed down. So people used to muzzle, like when you're saying vaccine, you just say zzz, or if you want to say COVID, just say, something like that, because there was a very calculated campaign to make sure people do not know that there was alternative treatment from repurposed drugs, that diet and vitamin D was saving people. And if you even notice that the people who were actually dying en masse in Kenya were the middle and upper class who didn't really sit out in the sun a lot, people in the estates. But like if you look at the slum areas, places like Kibera, where there's so many in the house, probably they all just go out first thing in the morning, they have access to sunshine. There were actually no deaths.
But we also know there was the idea of herd immunity.
Yeah.
There was also that conversation. The things that you've said, and I just want to follow a certain train of thought. There's an argument. If you look at the budgets for a lot of these pharmaceutical companies, then the money that they make from vaccines is much less to them compared to the money that they make through chronic disease drugs, for example. So the argument that the plan was to roll out vaccines to make money, it's not sustainable then in the long term compared to chronic disease drugs. So that is one argument. And I don't want to get into the details of it because I'll then very easily get into conspiracy theories around this. But those were facts in terms of the budgets and where they make their money from. But in terms of looking at the origins of this, because you've said this thing was actually manufactured as a bioweapon, we've looked at, scientific and credible evidence then of SARS-CoV-2 before we started talking about COVID-19. And the closest relatives of the virus were found in wild bats. That is a fact. And this is in southern China and Southeast Asia. Now, the two scientific hypotheses, because I covered this story in COVID Millionaires, the two things that we're looking at, one is if this is a natural spillover, which then you tend to disagree and say this was actually clearly planned. The natural spillover then from wildlife to human beings. And then from human beings, they start spreading it amongst themselves. And the second bit was now this accidental or deliberate lab leak that this thing was manufactured in a lab in Wuhan, and then it was spread, the virus was spread around the world. These two are still being studied. However, there's a Wuhan Institute of Virology and Funding, which does a lot of the researches on coronaviruses, where this thing actually leaked from. And some of the research, which the US intelligence in the assessment actually ended up declassifying in 2023, saying that the virus was actually not developed as a biological weapon. These, are just records as well. So we can quote records and then declassify this. And we can also quote records that then speak of, okay, so Dr. Fauci was mentioned, or there was a letter that then is purported to have been written, and money that was actually that was paid. So the claim that COVID-19 then was designed to reduce the world population has had a challenge in getting verifiable data and facts. So the thing is, when we say that it was released to depopulate the world, the people that it ended up killing in Europe, Ndo's quoted Italy, in the United States itself, Asia, from all the way from India, all over, it was not picking certain individuals. This thing was killing so many people. And it was, the thing is, when you say natural selection, so it is, if you get it, depending on your immunity status and so many other factors, then you are prone to either have long-term effects of the virus or you'll actually simply die. So if the plan was to depopulate the world, how are they insulating themselves from, or people who are close to them from not getting this virus to begin with?
Okay, first of all, I'd like to refute the fact that they didn't make money. Pfizer and Moderna actually did make a lot of money. That's why the word COVID and vaccine is not having your channel flagged and demonetized or whatever. They've already made a lot of money, in the hundreds of billions. Yeah. So that one is in the public domain also, the kind of money that they have made. And yes, a lot of money. I think we go back to the issue that the money was to be, it is, there are three things that they do to make the money, to depopulate the world, and of course, that is, the Hegelian dialectic is, I'm going back to the solution, the problem, create a problem. That problem was not the one that was going to be the massive depopulation. The depopulation was going to come from the massive vaccination exercises, which is how they got their money. And like you said, the big pharmaceutical agencies.
Wait, did you say, so the depopulation was not the release of the virus itself, it's now the vaccines?
No, it was from, the release of the virus itself was to create the terror, to get the problem, and then you get the reaction from the people, lockdowns and all, everything was planned, how you get the lockdowns and people losing their businesses and all that. And then you telling them that we will only go back to normal when this happens. Like telling people you will not get a job. You had talked about yourself being coerced. Many people were coerced into it. And all this is against the Hippocratic oath that we doctors took, which is fully informed consent. First of all, you're supposed to do no harm. That is non-maleficence. The second one, always do good. Number 3 is fully informed consent. And the fourth one is justice for all, including exposing when malpractices are performed. So this whole thing of the emergency youth authorization, the doctors calling this safe and effective. And yet, in fact, Pfizer and Moderna themselves have confessed that they talked that it was an experimental. It was an experimental mRNA agent. But they even said that if we had used those words, experimental mRNA gene therapy, nobody would have accepted the jab. But they have confessed that that's what it was. And now they had to call it a vaccine so that people who were terrified to death. I mean, we're having like car accidents, yeah? Like 10,000 car accidents. People are dying of malaria. People are dying from AIDS. But at 3 o'clock every day, you would have, what's his name, Mutahi and Mwangangi on TV telling how many people have died. And the numbers were much less than that, than from car accidents and other things. So the whole idea was to terrify people to death so that they would
take the
Yeah.
vaccine. So Dr. Tatu, so the idea is, okay, create all this chaos and
Yes.
reactions.
Yes.
Then people take vaccines. So
Yes.
the depopulation now is
Yes.
after people have taken the vaccines.
Mostly.
So
Not from
That
the
was-
disease itself.
Not from the disease. The disease itself was to create the fear.
So, Dr.
Yeah,
my
the
question
they
is,
knew they would get their
while
numbers.
creating the fear and coming up with this bioweapon, as you call it, you look at the people who died because of the bioweapon, it was
Yes.
from the West. So my question to you is, was this bioweapon targeted to the people in the West because then they knew that the terror would be sent? But then again, there is the question of the batch numbers of people who were injected. You say some were injected with saline and water. What evidence do you have to show that actually happened? And did you take any of these batches into laboratories for you to say, this happened, this is my evidence? Because absence of that, all that you're saying remains just being hearsay.
You can actually trace your batch number, and there's something which is called.
Have you
the
traced any
virus.
batch numbers yourself
Not
for you to
personally,
say?
Not personally, but I know people who have.
So then what
There's the
evidence would
fee-
you have to back everything that you're saying right now?
Okay, there's the international organization called VAERS, the Vaccine Adverse Effects Association, where you can actually send when you've had an adverse effect, you can actually write to the organization and tell them that you've had an incident. So under that organization, then you just say the hospital and you get the batch number. That's where people were doing it from. But people were not, people are actually very afraid of speaking out, because they do remember the people who were being called anti-vaxxers, and they were mocking them. So now it's like they are feeling very ashamed that they did get adverse effects, and they have one of them, they're generally afraid of being picked up and being harassed and being tortured. Yeah, so they we try to convince them that they can. Some have, but some haven't. And so there are many Kenyans who are suffering the adverse effects of the jab. There's a lady who even came to me at a funeral with her. I saw her introducing herself, and she actually gave me her husband's funeral. You have this funeral? What do you call it?
Eulogy.
Yeah, the eulogy magazine. And she's telling me my husband died of lung failure after the COVID infection.
Was there any lab
After the
tests?
COVID infection, not the vaccine.
So there are some people who actually died. In fact, we have many friends who passed on from the COVID infection. But you see, the whole response of the World Health Organization suppressing the treatment, and then putting people under ventilation, and giving people a drug which is called remdesivir, which actually causes kidney failure. All these were on the protocol. And remdesivir had been banned they had found it to be very, very toxic during the Ebola pandemic. So this is what they were now saying must be used. So that is how my friend also died, you know. She was given remdesivir, she was put on a ventilator, and it was like, you know, they were using methods that were known to cause death. So we did lose a lot of people from the infection itself, but now we continue to lose people from myocarditis, from clots, from stroke. Many women and men are actually infertile. So we're getting so many problems now, which are coming so much longer after the fact. But even Dr. Peter McCullough has said that 73 up to 74% of the deaths were found to be caused by the jab. So, like in those in the Western countries, the people who died from the jab were after the jab were investigated and postmortems were done, and it was found that up to 74% were directly related to the jab. And Dr. Arne, who has done all the postmortems in America, he came back from retirement. He did all the postmortems, and he directly was able to relate it to, because you become, after the jab, you start making spike proteins. If you've gotten the poison one, it makes you produce
Sorry, if you've
spike
received
proteins.
the poisoned one?
Yeah.
The poison jab.
The poison jab.
Okay.
Yeah.
Poison
So-
vaccine.
mRNA.
Okay, so you're
Yeah.
saying for us who took the jab,
Not all of them are poisoned.
no, the
Yeah.
Tatu just hang on.
Yeah.
So for those who took Johnson and Johnson, I don't
was
know
my
which one
third.
you took. You
That
took
was my
your
third,
Johnson
yeah.
and Johnson.
Yeah.
Which one did you take? Pfizer.
Yes, I took the
There was
Pfizer
Pfizer
one.
and there was the
I also
first
took.
one.
I also took the Pfizer one, and then we
Moderna.
were later told you can actually
Mix them.
You can mix them. It's not a problem. So the first jab was the Pfizer, second one was Johnson. So you're saying these vaccines in our bodies, the whole agenda of this whole conversation is to depopulate the earth.
Yeah.
So if you're not dying instantly through the virus itself, then you have long-term effects or sicknesses and illnesses that will catch up with you later in the years that then will lead to deaths and therefore depopulating the earth. That was the agenda.
And morbidity, yeah.
And morbidity. So you're saying infertility is one of them.
Oh, yes. We have
In both men and women?
Yes, we have a huge upsurge of people who are suffering from infertility right now.
Is there any research to back what you're saying?
Yes, there's a lot of research. In fact, there's the whole book
Done
that
locally
is
here in
out.
Kenya, and one would ask the question in terms of infertility cases in the country as we speak today.
Yeah.
What are the numbers before COVID and after COVID?
That research, I don't have the numbers for that. But what I do know is that in 2014, the World Health Organization actually did roll out a so-called vaccine called the anti-tetanus vaccine. They made a campaign for all women of reproductive age from 15 to 45 to come for the what you call it, tetanus toxoid, to, in inverted commas, prevent their child from getting tetanus. And the Catholic Doctors Association actually isolated, took samples from those and discovered that there was something called beta HCG in there that was actually bound to the toxoid, the tetanus toxoid, to make the woman make antibodies to any future children. So the women were actually aborting their children without knowing it, and many of them became sterile. Actually, one of my friends is one of them, and they actually did isolate that. So this is one of the reasons why we cannot trust the World Health
Are you a
Organization.
proponent of vaccines? Because the association you're referring to has rejected a lot of vaccines, including baby vaccines, women vaccines. Do you believe in vaccines?
I'm not an anti-vaxxer. All my children are vaccinated. The problem I have with is unnecessary vaccines. Yeah? So like Ndu started with the beginning, the first question you should ask is it necessary? Because really we're a third world country, and we need money for things like malaria, we need things for TB. So if you have something, for example, if you take the hepatitis vaccine for a newborn, yeah, every mother in Kenya is tested for hepatitis B, blood group. You have wives, yeah? And she's tested for HIV, yeah? This is a sexually transmitted disease. My children are all vaccinated, but they're all adults. Now, why would you introduce hepatitis vaccine for a newborn, a sexually transmitted disease, in a baby whose mother has been tested for hepatitis? What's the rationale? Because it's very good to test for hepatitis B when somebody is sexually active, yeah? This child, I'm assuming they won't be active for the next 10 years, at least. So why are we giving hepatitis jab to a newborn, and it protects somebody for 10 years? So the rationale is actually there's a lot of things which are unnecessary. Yeah.
Like what? So what are the necessary vaccines? What are the necessary vaccines? Hepatitis clearly is an unnecessary vaccine, according
for a newborn, right? For a newborn,
according to what you said. So what are the necessary ones then?
I would think of, like this rollout of, what is this vaccine which is being given to girls in schools as an anti-cancer vaccine? HPV, yeah? If you do your pap smear, it can actually protect you. It can actually...
it will show you if there is an abnormal growth of cells.
Yeah.
Okay.
So every 2-3 years, if you do your pap smear, that is enough. So the so-called HPV vaccine only prevents against like 2 strains. Yeah. So why is it being rolled out en masse on our daughters as a mandatory vaccine and then marketed? You see, the marketing is very important as an anti-cancer vaccine, anti-cancer. But yes, it's true that cancer of the cervix is caused by this virus, HPV,
yes.
Yeah? But when you give your 13-year-old girl, for example, the HPV vaccine, what are you telling her? Because it's an STD, isn't it? You're telling her it's kind of like a license to become sexually active.
Oh, that's one side of the argument.
Okay, so anyway,
a blanket thing that you're saying.
Anyway, what I'm saying is, if there's something much more cost-effective, like a pap smear, as soon as you become sexually active, you can do a pap smear every 2-3 years, which will show abnormal cells in the cervix, and that can be treated very quickly, very, very on a much cost-effective scale compared to just en masse giving high school girls an HPV jab, which has actually been found. If you check the documentary Sacrificial Virgins, that will tell you how many people have sued because of the adverse effects, especially neurological, of the so-called HPV vaccine.
Okay.
But it was actually pulled off YouTube, and you'll only find it on Rumble and other alternative media.
One of the issues is the time that it took. We should go back to COVID for a little bit because our time is running out. Is the time that it took to develop the COVID vaccine. We have vaccines that we're using today that have been in trial runs for decades. And then it, brings them forth after a very long